Welcome to Quick Medical Review. Today, fetal circulation in under 5 minutes. Let's go. Buzzwords first. Ductus arteriosus connects PA to aorta, closes with oxygen and indomethacin. Foramen ovale, right to left atrial shunt, closes with increased left atrial pressure. Ductus venosus bypasses the liver from umbilical vein to IVC. Prostaglandin E1 keeps the ductus arteriosus open. Indomethacin closes the PDA. Let's break it down. Fetal circulation is fundamentally different from postnatal because the lungs are not functional in utero. Gas exchange occurs at the placenta. 3 shunts bypass the non-functioning lungs and liver. Shunt 1, ductus venosus. Oxygenated blood from the placenta travels via the umbilical vein. The ductus venosus bypasses the liver, shunting blood directly from the umbilical vein to the IVC. This delivers the most oxygenated blood to the heart. Shunt 2, foramen ovale. Blood entering the right atrium from the IVC is preferentially directed through the foramen ovale, a hole in the atrial septum, into the left atrium. This right to left shunt sends oxygenated blood to the left ventricle, then to the aorta, supplying the brain and coronary arteries first. Shunt 3, ductus arteriosus. Blood that does enter the right ventricle is pumped into the pulmonary artery, but because the lungs have high vascular resistance, most of this blood shunts through the ductus arteriosus from the PA to the descending aorta, bypassing the lungs. This blood goes to the lower body and back to the placenta via the umbilical arteries. At birth, dramatic changes. First breath, the lungs inflate, pulmonary vascular resistance drops dramatically, blood flows to the lungs. Left atrial pressure rises from increased pulmonary venous return. This closes the foramen ovale by pressing the septum primum against the septum secundum. Oxygen, the rise in PO2 causes the ductus arteriosus to constrict and close. Prostaglandins, which kept it open in utero, decrease as the placenta is removed. The ductus venosus closes, becomes the ligamentum venosum. The umbilical vein becomes the ligamentum teres. The umbilical arteries become the medial umbilical ligaments. Clinical relevance. Patent ductus arteriosus PDA when the DA fails to close, common in premature infants, continuous machine-like murmur. Treatment: indomethacin or ibuprofen. Prostaglandin synthesis inhibitors close the PDA. Surgical ligation if medical therapy fails. Prostaglandin E1 alprostadil given to keep the ductus arteriosus open in ductal-dependent congenital heart lesions. These are cyanotic heart defects where blood flow to the lungs or systemic circulation depends on the PDA remaining open, such as transposition of the great vessels, pulmonary atresia, critical coarctation. Patent foramen ovale PFO present in about 25% of adults, usually asymptomatic, can be a source of paradoxical embolism. Venous thrombus crosses through the PFO to the arterial circulation, causing stroke. Example: 3 fetal shunts. Ductus venosus bypasses liver, foramen ovale bypasses lungs. At the atrial level, ductus arteriosus bypasses lungs at the great vessel level. Indomethacin closes the PDA. Prostaglandin E1 keeps it open. Oxygen triggers DA closure at birth. That was fetal circulation on Quick Medical Review. Study smart, not hard.